Okay, thank you for this invitation. It's a great pleasure for me to be with you and to tell you what we are doing inside the CEPS and how we see from a European perspective the trends, because we know that healthcare is a key topic at a worldwide level. So first of all, a brief introduction on what is CEPS. CEPS is a non-governmental institution where we have launched a lot of different clubs of different strategic topics. We have defense, army, smart city. So inside the CEPS, we have only decision-maker people coming from different origin, and we decide to discuss without any how can I say, commercial view. It's really prospective view. We have meeting, we discuss, we exchange, we put the ideas, and we have and we put some documents at European level. We send a strategic view of what we are doing. So inside CEPS, we build strong partnership. We are partnership with OECD, with European Commission, with UNESCO, and we put out what we are doing in terms of new ideas at European level, and we try to move, to go in to change the ideas, to change the paradigm. And the idea inside this club is that we work with different people coming from industry, science, university, political, expert. We work in a 360 degrees strategy. So the eHealth Club, we launched this club 2 years ago, and the idea was to understand where we are going in this field. So it's an independent health think tank, and inside this club we have different people coming from venture capital, startup, innovative company, pharmaceutical industry, insurance, professor coming from the university. So the idea is to have a lot of the people around the table. It's a small session. We are no more than 40 people during this session. We work. We have also space for networking. And after that, we put synthesis of our idea and we put at international level. That's the idea. And what is very original is that about one topic, we have a different view for different players, and we try to find what is the key driver and what will be the future. So it's a pleasure to be there, and we work on a lot of interesting topics, and we invite, so it will be the idea to give you some samples later. So just to give you what is the organization, we have a board because we invite very important people, sometimes coming from GAFA, sometimes coming from genomic, sometimes very entrepreneur people. And so the idea is to develop this club, because CEPS has also club in different countries, in Africa, in London, in Brussels, and we hope in the future to be also in China. So now let's go really on the topic. What is very important to know is that we have really now, even if I am a doctor, we have really now a big change of paradigm. It is what we call the patient empowerment. Now, the healthcare topic, and we see really that in Europe, but I know it is worldwide, the patient wants to take in charge his own healthcare capital. That's a big paradigm. At the beginning, healthcare, when we are speaking about e-health, we were really focused on hospitals. We think that the hospital was the main center for data product. All the big quantity of data were coming from hospital. And more the things are moving. Because we say now in Europe, hospital must open the door. They cannot catch all the data inside. They need to open to different structures. GPs, it means doctors who are working in liberal activities, and also they must go at home to the patient. It's what we call the personalized health, because now more and more the big quantity of the data will be produced from home. So it means that for the next 10 years, we will see more and more that the big amount of data will come from home more than hospital. It is a change, it is moving. So the idea is how the technology can help and can support this big change. So if you see the evolution in terms of technology, we had first the mobile with a lot of data consumption. We move on Internet of Things, so we'll generate a lot of quantity of data. But if you have a lot of quantity of data, the question is, how can I analyze this data? So of course, we are near the big data and the cloud and the analyze. And now after we analyze the data, how we can share this data between all the healthcare players. So we have a big evolution, and it's what we observe particularly in Europe. So, but I will explain after that during the panel what are the difficulties if you compare. If you see the analyze now where we are, at the beginning I explained eHealth, it was really focused on hospital. More and more, and it is the level where we are in Europe, we try to work at regional level to build regional platform. So we open the hospital and we connect the hospital with the healthcare environment. And we see on the top, and some countries are in advance, we go to the more global level with telehealth, mobile health, to have a more global approach. So what we can say is that in Europe we are more focused now on regional platform. We push a lot telehealth. I will give you a lot of details. In some countries like France, the government take a lot of initiative, and they try to give an incentive for the doctors. They try to push a lot of money. But the idea is to be really cross-regional, national, and more in Europe. The idea is I am a citizen in Europe. I travel in Switzerland. I go in France. I want to have my medical data, and I want to share my data with any healthcare professional, whatever is my location. And that is really a problem for the state because they have different regulation, but we can discuss this point. So what I want to tell you is that if you consider that we have a new paradigm and that the patient is taking the power, all the structure must follow what wants the patient. And healthcare professional must follow. If you analyze now the market, because I have an industrial view, more and more the business was focused on B2B. It means infrastructure, network, electronic patient record for hospitals. It was the first market, the B2B. More and more we evolve on the B2B2C market. It means C is the customer, B is a healthcare professional, and the first B is the payer. What is very original is that if you take some European countries, and it is different from US or maybe different from other countries. What is very interesting is that you need to have someone to pay. In B2B2C, you have mobile health, telehealth, IoT, all the topics. It means you catch the data from a patient or a citizen if he's not sick, and you use this data for a healthcare professional, and you have somebody to pay. So if you take some example, in France, it is the insurance. In Europe, it is often the insurance, but you can also imagine pharma for medical survey and for study. And the last point is the B2C. The B2C, it is what I call more prevention, wellness. C is the customer, B is the payer. It can be a different structure. It is a new market. For an industrial point of view, it's more difficult to generate business at this step on the B2C. The economic business model is not completely clear. So, but probably you have a lot of self-quantified things with tracking, watch. Okay, everybody is launching something. It's very interesting. When you are a patient, you play with that, but you generate data, but after 3 months, you say, okay, I stop because it's not personalized. So you need to personalize when you try the data. So just to give you how we can segment the e-health market, it's difficult to do, but so keep in mind B2B is traditional, B2B2C is where we go, and there is a lot of investment, and B2C, it's something that industry will explore. So now, what is very, very important, we are facing in e-health of what I call the big bang. Bang, it means that the amount of data that will be generated will be enormous. So it means that B is for biotech, A for nanotech, and it is new technology, information, communication. It is all the chronic disease. We know that we are going to be an elderly population, so a lot of data will, and you have the genomic, because more and more the future of the precision medicine will be to analyze those data. So what I would like to tell you is that the Big Bang means that it will generate on the network big amount of data. At this step, we are not sure that the infrastructure and the network are enough efficient when all this topic will be mature. So there is a big topic. It means that the success for digital to manage all this data coming from the patient in the next 10 years will be to have solution with new service, secure, but you need to be sure that your infrastructure and your network is able to drive that. And generally, when you discuss in e-health, I discuss with startups, they launch new service, but in fact, they are not sure that the connectivity will be able to be efficient to drive all this data. So the success of the digital will be an alliance between new usage, new service between patient and healthcare professional, and infrastructure and network to drive the big amount of data and to analyze them. So we are facing to the second revolution of the digital. I agree with the last speaker. IoT, blockchain, robotic, intelligence artificial is the second wave of the digital revolution that will arrive. The first step, more or less, we have done a lot of things. So what I would like just to tell you to conclude is that Einstein said often that there is no innovative people, there is only late people. So I would like to tell you that the most important risk is to take no risk. Thank you.